So if you're a runner or you actually work out in general and you're overusing your adductors without realizing, and the way you know that you're going to realize, I'm going to discuss in the video, there's a very, very, very good exercise that I strongly recommend, especially for runners. So stay tuned. Hey, this is Dr. Shaki from Irvine Spine and Wellness Center, your Irvine Posture and Movement Clinic. Your adductors are probably one of the overused muscles in your body. Why? Because when you don't have proper stability in your pelvis, you tend to kind of go this way. Not so much like this. You're not going to see people walking like this, but in essence, when they're standing up, their adductors are kind of overworking. And we see that in functional movement assessment of our patients, and when we do DNS exercises with patients and see that they're not able to produce the move properly. So in order to work out the adductors in conjunction with the rest of your body in a fashion that is more for more active individuals, I may recommend this move. Desiree, can you come here and we can demonstrate? So for this, we're gonna start with the quadruped. If you have no idea what quadruped is a movement that we all did at about age 7 months, and it has certain requirements. We're gonna make sure that we put the quadruped video here so you can go back and watch what it takes to do the quadruped correctly. For this move, we need to start with quadruped and have a neutral spine. So the head is gliding up instead of dropping, because that's going to take away some of the effectiveness of this move. The spine is neutral, so you're not arching your back like that. It's nicely up. Your feet and your legs are flat on the floor to provide a better support, pushing the thigh bone into the socket and supporting these two corners of this rectangle better. You're pushing the ground away and you're up. And with that said, and making sure that your knees under your hips and your wrist is stacked right under the shoulder joint. Go ahead and bring the leg out, one leg at a time. And what you're gonna make sure is not gonna happen is that your pelvis is not going to tilt it up. We're over exaggerating, but you're making sure that's not happening, or you're not losing that rectangular shape. So this is nicely set like a tabletop. Your foot and your leg on the opposite sides on the floor to provide a better support. Your glutes are pulling the joint, the hip joint back towards the back wall, and the leg is extended, and that stays there. And now we're gonna move forward with the bent knee. This is bent elbow. That's not easy to do, and push off and go posteriorly and go forward again. So I noticed Desiree in going back, go back. She bent that knee a little bit, so I'm assuming that was a little too much for you here, or does
it's tight?
It's tight, so we can go back and just stop. So don't push it. If you feel too much tightness, it's okay to bend, but go through the movement, and over time you get to stretch the whole adductor properly. One thing that I strongly recommend for people to do prior to doing this exercise is to actually grab the belly of that adductor muscle and kind of squeeze it, compress it a little bit more. Studies are now showing that the muscle spindles, when you're activating them with deep pressure, they actually assist you with better proprioception. So you kind of almost like get the brain pay closer attention to the movement and to the awareness of the joint better. So why not? So just not massaging it, don't dig in. It's not a deep tissue massage or anything. Just grab it and just kind of squeeze it a little bit along the belly of the muscles in the adductors, and then proceed with the move. This is a great move for all runners, all active people. Frankly, I think for everyone, because we're all sitting and our adductors are jacked up. Anyway, if you have any questions, make sure you use one of the methods of contact in the description box. And if you have not subscribed to the channel, it's time to do so. Until next time, take care.